remembered and not done it all, and it's like, oh man. Alright, so some of you have sealants, some of you guys don't. Sometimes it could be like a double-edged sword. You can do a sealant, and if the patient isn't a patient that comes in every 6 months to check, they can crack a sealant, and if it's not caught, you get leakage of that sealant underneath, and what happens when you leak and you don't clean underneath? You end up with a blown out tooth. So it's got to be on a patient that has good hygiene and is a patient that comes in. If not, I'd rather not put a sealant. Again, to place a sealant, the dentist diagnoses which teeth would benefit from the sealants and which patient would benefit from the sealant. Usually their posterior teeth that are newly erupted and caries free would benefit from the sealants. The sealants may be placed by the dentist, the dental hygienist, or the assistant, depending on the laws of the state. Okay, what you need are the basic setup, all the normal stuff. You need a rubber cup, you need a slow-speed handpiece, and flour of pumice. Okay, and we'll show you that paste. It's not the Profi paste that you do to polish teeth, because that has fluoride. You want a polishing paste that has no fluoride. Okay, and that's like sand, basically. If you do apply fluoride, you don't get as good a bond. So you basically use the gray sand pumice that we have there. Okay, you need etch, which is the blue. Some of you guys that came in and I asked you questions on which was the etchant, and you guys know it by now, right? And sealant material. You're going to use an applicator brush or whatever to put it in the tube. You need a curing light because the sealant is a composite, so you have to cure it. You're going to use articulating paper to check the bite, and floss if you need it. Okay, so what's the procedure? First of all, you're going to pumice the tooth. Okay, so depending on which tooth you need, you're going to get your rubber cup, make a little muddy slurry of the pumice, and you're going to polish on the tooth. And then you're going to wash it and dry it, making sure everything is nice and clean. Then you're going to isolate. You're going to put your etch on the biting surface, or where you're going to seal. Sometimes the back teeth, a molar, will have a buccal pit that you want to seal as well. So you make sure you apply enough etchant there. The etchant you're going to leave about 15 to 20 seconds, okay, after you've pumised. 15 to 30 seconds.
Are any of these going to be starred or supposed to be starred?
I don't think so.
It's on the study.
Huh? It is on this?
Mm-hmm. Yeah.
What is it? What's on the study again?
Sealant procedures.
Sealants.
The curing light, some of them will be starred. The curing light, I'll get to that. Bleaching tray impression, I'll get to that. Sealant requirements, what is it? I think I'll get to that. Sealants, basically what is it? Well, you should know what a sealant is. And the procedure is just kind of know. I think I have stars where we need stars. Okay, so after you etch, again, 20 to 30 seconds, then you're going to rinse and dry. We can use somebody when we're going to break up into 2 groups of 4. On the mannequin, you won't get this chalky white appearance, but we can use somebody as a guinea pig and etch somebody's tooth, so you can see what it would look like. Or if somebody needs a sealant, we can do a sealant on somebody. But once we separate, we'll do. So let's see. So you want that chalky white appearance on the enamel, and then you prepare the sealant, and it comes in a little syringe, or there's different ways depending on the manufacturer. And you want to flow it into the pits and the fissures. This is big. You don't want to overfill, okay? Because the sealant is not very strong, and if you have a bite, if you check the bite and it's hitting on that sealant, it's gonna crack and it's gonna fail. So you want that sealant down on the bottom where it's not getting any forces. This you need to know, to hold the light, the curing light needs to be 2 millimeters directly above or perpendicular, okay? You don't want the light out here, here's the tooth and the light's over here going at an angle. You want that light right here, 2 millimeters above the tooth. And pay attention, there's either a shield that you can use or something you can do so you can be seeing where you're putting the light. You don't want to be, if you don't have a shield and you turn it on and you're looking away, that light's going to go over here. And guess what? That sealant's not cured. And it's going to fail. After you cure it, you want to check the sealant. You run your Explorer and you just rub it for, you know, through all the surface, and it should feel like ice, like you're on smooth. You know, it shouldn't catch. If you have a bubble, you're going to go and it's going to go click. You're going to fall. And that's not good, because if you have a bubble or a little void, guess what? Plaque and bacteria start to get in there. Okay, you want it smooth. That Explorer should go from tooth surface to sealant, just smooth, you know, up and down, and you shouldn't get any catching. If you do catch, bacteria is going to stay in there. It's going to fail.
Do you just add more then?
Yeah, you can. As long as it didn't get contaminated with saliva or anything, just get a little bit more and fill that little void and re-cure it. If it doesn't, then you take it out and redo it. So here, as long as it's not if it is contaminated with saliva, you've got to re-etch and then try to reapply. Okay, dry the teeth and check with articulating paper for high spots. If any high areas are present, dentists must adjust them using a high-speed end burrs. That's the test question. Okay, what is the test question? I think, is there any adjustment needed to the occlusion of the sealant, or does the occlusion matter, or something like that? And yes, because if it does, just think about it. It's a weak plastic. And if it's getting pounded on by the opposing tooth, it's going to break. And when the patient comes in a year later, you're going to have a problem. Okay, so again, here we've seen this before. There's the little fissure going down. You put your tip right in there. Try to fill this area. Okay, so there you have the unsealed and the sealed. And again, when you run your Explorer, you should go from tooth to sealant, from sealant to tooth, from sealant to tooth, from sealant to tooth. Smooth. It should be a smooth transition. Okay, application. Okay, here you go. You're going to isolate. You got your saliva ejector, retraction, whatever you're using. Again, you can see it's a gray pumice. You've got your Profi. I don't know if you guys have this. I don't think you guys have this. But again, you just pumice the biting surface of the tooth, and you're getting rid of that pellicle, smooth, sticky material. Okay, just clean it really well. Rinse and dry, and here you're applying your etchant with a little brush. Okay, get your etchant and just make sure you brush it into all those grooves and crannies. Leave it in there for about 20 to 30 seconds. You rinse and dry, and again, right when you rinse and dry, your enamel should look how? Chalky. Chalky enamel. It shouldn't be shiny like this. It's going to look chalky. Then you get your sealant either on a brush or on the little syringe. Not sure which one we have today. But you just go in there and you put a little bit right down on the grooves. Okay. Make sure you don't overfill. If you overfill, you may wipe it down with another brush. And make sure you don't leave too much. Then your light goes 2 millimeters right over the sealant. Quick for about, depends on which light. My light, 5 seconds and it's cured. Other lights you could, it should be 30 seconds depending on which light you have. You finish, and then again you run your Explorer from the tooth, especially here in these grooves. Okay, this is where you'll get a little bubble right in here on the transition from tooth to sealant. Make sure you run your Explorer up and down through all these grooves. Make sure it just slides up and down. Okay.
Could Can they technically put like sealants on baby teeth?
You can, except baby tooth enamel is not the same as adult tooth enamel. The if you look at it under an electron microscope, the prisms, what the sealant bonds to is not as defined, so you get a weaker bond.
Is
So
it the same with like composite?
it is,
Okay.
but except in composite, you've got cut enamel, which is different than uncut enamel. So to put a composite, we're making a prep, we're cutting into the tooth. So you're cutting the enamel sideways, so you're bonding this way. Whereas on sealant, you're just putting it on top, and it's uncut enamel. You haven't really cut it, so you're not going to get as strong a bond as when it's cut enamel on a baby tooth. So I rarely put, unless I have a really deep pit, and I'll probably put composite versus sealant material if I'm doing it on a baby tooth, because you get a better bond. Who's white? Bleach. Couple of, yeah. Either with crest strips or, again, all the materials work. Some work better than others, but they're out there. This is usually the material that it is, carbamide peroxide. Okay, so what you need, your basic setup, mirror, explorer, cotton pliers. What impression are we using? Alginate. Okay, that's right here. Bleaching tray impression. Alginate. Okay. Why don't we don't need those are the models that you guys have here. You guys took alginate. It doesn't have to be exact. We don't need too much precision. We just need, a model of your teeth. Okay, the mixing bowl and spatula, obviously for your alginate, you need the impression trays, and we've already done this, the impressions, so you need whatever kit. We use night white from Discus Dental, so there's all kinds, there's opalescents, all kinds. And they're all good. Some patients say some have sensitivity, more sensitivity than others, but they all whiten. And what's actually whitening, what's actually causing the stain on your teeth are porous, basically. And so the pores absorb the particles, whatever it be, food particles and so those pores have the particles inside, and the wine or the other food, blueberries, or over time, they end up staining the particles that are inside the enamel. So what you're whitening is actually everything that's embedded inside the enamel layer, and that's how we whiten. So this is a test question. A complete dental exam, including a full month series of X-ray, periodontal evaluation, and oral cancer screen, is completed. Okay, so the question I think is, it's true or false, and it says that a dental exam is not needed when whitening. So yes. Okay, so all necessary procedures such as fillings, crowns, periodontal treatment must be completed prior to the bleaching process. We have charities that come and ask us for donations, and so we'll donate, free bleaching, or we'll donate whatever for a family of 4, dentistry for a family of 4, or whatever. But when we do the whitening, we don't just do a free bleaching, because you can't just do a free bleaching. You've got to do an exam, x-rays, cleaning, and I put down there there must be no periodontal disease and no existing caries or failing restorations. If not, they have to get that done before I can do their bleaching. If not, they need to give that to somebody else who can bleach, because you can't bleach on somebody that has these existing. If you do have a big cavity, you put that carbamide peroxide on there, you're going to end up needing a root canal, because it's just going to soak up that chemical into the bone, and it's just doing more harm. So once all the work is complete, you take the alginate impressions, maxillary or mandibular, whatever you're doing. Patient comes back, you're going to have the stone models like you guys have. You're going to trim it. Dr. Cervantes will show you how to trim it. You need a nice thin model, and you're going to vacuum form a tray. You're going to cut that tray, patient comes back, and you try it in, make sure it fits right around the gum line, and then you tell the patient how to use it. Okay, so here's your alginate, here are your models. This isn't really a good model. Why? See down here, you can't see the teeth. This one would probably work okay. Back here you can't. Okay, so you're gonna, one thing that you want to do is make sure you got no bubbles on your margin, because this is where you want to seal. When you do your suck down, you want your tray to be right there. You don't want it to come over into the gum tissue. You want to come scallop it around your gums there. Normally you put some block out, and I think he'll have you do either half of the mouth or I don't know how much. But you put a little bit of block out on the outside of the tooth. And it's just that this is a composite. You just put it and shape it right in the middle. You can see how you can have it right in the middle. What that's doing is just creating a little reservoir for the bleach to stay in there. It just so if you don't do that and you have the tray, then you have the tray up against the tooth, and it'll still work, but if you have more material there, it'll whiten a little bit better. And you don't have to come all the way back here. You shouldn't be whitening, past maybe the second molar, if that. There's no need to whiten your molars. Nobody's seeing that. Normally it's from premolar to premolar, and that's when you smile. Unless you have somebody that smiles like Tiger Woods, way back there, then you whiten back there. But you shouldn't be whitening back here. You're just wasting material. So here's kind of what the model should look like from premolar. Here's canine premolar, and there's the suck down. Okay, so here we have one of these here. You put the model in there. This gets really hot, so you got to be careful. Okay, the top is where the heater is, so that goes up and down to melt the plastic. Once you take it down, turn it back and turn the heater up, but it still stays hot, so don't burn yourself. When it comes out, then you're going to cut it with some scissors. I think we've got 2 or 3 scissors. So here's kind of what it should look like. Okay. For me personally, I think this is overextended, but I like it right at the gum line.
Is the bleach going to hurt your gums?
It'll irritate your gums, yeah. And sometimes when you take, patients will come in and their gum is white, like right here. Their gum is white because bleach got on there, and it dries it. It'll come back. I mean, it's not going to slough off or do anything, but the papilla here will be white sometimes, and they'll come in all scared. So when you give their instructions, when you give them their kit, and you give them all how to use it, how to apply it on there, you tell them. You may get little white areas between your teeth, and that's just your gums that's got dry, desiccated from the material, but it'll turn pink again. If not, they'll take it out and go, they'll be calling, or they'll be in here. Okay, so I normally trim it right to the gum line, maybe just a little bit long, because in the mouth it'll be a little bit shorter. But again, that's whatever the dentist likes. Where are we at? Lunchtime? About 10 minutes. Sounds like I finished the other one in 10 minutes. Which was that one? That one was Sealants? Ooh, there's 40 slides.
We're almost out of labs.
Yeah, we're almost done.
4 weeks. Anyone's done.
Okay, somebody stop me at 12, okay? Well, let's start this and then we'll finish right after lunch. Periodontal treatment, coronal polishing. Okay, preventive dentistry and oral hygiene. Okay, scaling, prophylaxis, and polishing procedures performed by the dentist or dental hygienist. Okay, scaling, prophylaxis, or polishing. Dental assistant duties includes instrument transfer, rinsing of the oral cavity, evacuation with a high volume evacuator, removing of debris from instrument, retraction. If somebody, who helped me with Sandra, you helped me with a patient. So this is what you were doing. You were retracting, you were rinsing, you were cleaning my instruments. So that's your job, that's on the test, that's the question, okay? Transfer instrument, clean the debris off the instrument, retraction, suction, rinsing, okay? And again, you guys know what you need here. You need periodontal probe, scalar, this is on the test, scalar, ultrasonic, curettes. Dental, so out of those, then there'll be another word that is not, so.
So for the scaling setup,
Yeah. Yeah, so it'll ask for a scaling and root planing procedure, you need these instruments. Which one don't you need? I think there's like a gun in there or something. You have to find which one doesn't belong. Procedure steps, scaling procedure and polishing. Okay, so we examine the oral cavity. We use a combination of scalars or curettes. We remove, after the plaque and calculus debris and stain have been removed, the operator polishes the teeth. I think this is a test question too. After the plaque, calculus, debris, and stain have been removed, that's when you polish. Okay, you don't polish before, unless sometimes you get kids that have, like they haven't brushed in weeks. And then I'll polish them before, so I'll clean them and then I'll repolish them. Because if you're just doing by hand, you're taking out gunks and gunks and gunks of plaque. It's never finished. So it's like, just get a shotgun and go clean it with a prophy cup first, a shotgun, and then clean them and then I polish. So I think this is the test question right here. After you clean everything, then you polish. And then you use dental floss and go back and check. Note, if the patient's periodontal evaluation results in generalized periodontal probe depths of over 4 millimeters, so what's over 4 millimeters? Stage 1, 2, or 3? Stage 2. The procedure involves scaling and root surfaces, using ultrasonic and hand scalers to achieve patient comfort. Sometimes we use local anesthetic if it's needed. This procedure is usually limited to 1 or 2 quadrants per visit. So this is scaling and root planing. Anytime we have a patient that's very sensitive, if I try to probe and the patient's doing this, you think I'm going to be able to clean? So I'm probably going to be doing a scaling and root planing where I have to numb that patient up. And some patients will say, well, why? Because I mean, that scaling and root planing, I'm charging $160 per quadrant, or a cleaning, we're charging $100 for the whole mouth. Why do I need that? Well, I can't work on you if I, so it's going to take me an hour and a half to do half the mouth, where it's going to take me, half an hour to do all 4 quadrants. So some patients, they just don't understand. They'll argue. Again, periodontium is this whole thing, the whole dental apparatus there. Okay, coronal polishing. The definition of coronal polishing is the process of removing stained and soft deposits from the coronal crown of the tooth. The clinical crown of the tooth. Okay, what we need to clean, you need a paste or an abrasive toothpaste. You need your prophy cup and a slow handpiece and dental floss. Definition of clinical crown is, you guys know, it's the part of the crown that we can see. The clinical crown is what we can see, what's exposed. What's the anatomic root of the tooth? Yeah, you do. You have the clinical crown, and then you have the anatomic root. So the anatomic root is just the part of the tooth that's in the bone. You had those questions, that was on the test.
That was just a really easy question.
Oh, you thought it was a trick question. I wouldn't trick you. I wouldn't trick you guys. I'm giving you all the answers. Okay, so definition of oral prophy. I think this is on the test.
the procedure.
complete removal of plaque, stain, calculus, and other debris from the teeth. I want to say that's, actually, that may be a fill in the blank. I want to say. It says this, the complete removal of plaque, stain, calculus, and other debris from the teeth is what? It's oral prophylaxis. Calculus, a hard mineralized deposit. Again, if you don't remove plaque, calculus is going to form. And that's going to start to travel down the gum line, and you get into trouble. Who may perform oral polishing? That depends on the state. In Arizona, you guys, if you're certified. In most states, a licensed dentist, registered dental hygienist, or a dental assistant. You've got to have a certificate. Oral prophylaxis, definition, the removal of stain. We just talked about that. The prophylaxis appointment. Again, you're going to, after we do a cleaning, you're going to give oral hygiene instructions and tell them how to maintain their teeth clean. You're going to tell them how to brush, floss, brush at least once a day or twice a day, floss at least once a day. You're going to show them how to brush, use the toothbrush. We're going to take radiographs, fluoride if they want. Not all patients want fluoride. It is an additional fee for adults, so you got to tell them if you're going to apply. You ask them if they want fluoride. Here we charge $11. If they want fluoride, insurances don't cover for adults $11, so they got to come out of pocket. So before you put it on, make sure that they know that they're going to be charged $11 when they leave. Nutritional instructions. You have a patient who has a lot of gum or a lot of caries on the gum line. Usually they'll be heavy soda drinkers, or you got to try to have them break that habit of drinking Dr. Pepper all day. So you try to see what they're doing and try to change their nutrition. Preventative dentistry, oral hygiene instructions, nutritional instruction, and other dental procedures utilized to sustain the level of health within the oral cavity. So all of these things you guys can be doing once the dentist is out of there. You give them. Benefits of coronal polishing: you can remove additional stain that you can't do with a hand instrument. Complete removal of debris may allow fluoride penetration effectively. That's the test question. That's on the test if it's not. So what does coronal polishing allow? It allows for complete or better fluoride penetration. Okay, got that? It doesn't have an asterisk, but that's on the test. Or I guess it does right here. Polishing Canadian preparation phase for dental restoration placement. So sometimes we'll polish a tooth before we bond a crown or before we put a composite or something. Smooth surface may delay the adherence of new stains or deposit. That's all.
Yeah.
Drawbacks of coronal polishing may lead to increased tooth sensitivity. Sometimes you don't want to polish too much down on the root. It may dull the surface of dental restoration. Patients that have composite veneers on front teeth, on all 6 front teeth, sometimes I won't polish with the gum line. I'll angle my polishing cup to polish right around the gum line. Because if, again, you're polishing with some abrasives, you're going to roughen up that restoration and it's going to lose its shine.
Would you use the same that you would use for an implant, just the gel?
You could, yeah, you could. For an implant, the only thing I do is I just use super floss to get down there. I don't polish, I don't do it, I skip it. And I'll use the plastic instrument, but I don't polish it. I'll just use my shoe shine effect down on the implant. On newly erupted teeth, they say sometimes stay away from polishing. I still polish them. I don't think it's that big a deal. Selective polishing. I think this is a test question too. Only polishing teeth with visible stain. I polish them all. Again, and the reason that is sometimes patients say that if they're more sensitive than others, you select only where you need them. You don't polish all of them. So I polish them all. Infection control, we'll stop there. I think he's at 12. Okay. We'll stop there. Let's go have lunch and then we'll finish the other half of this.